and that you're here and that you're still continuing to try to learn. Thanksgiving tomorrow, and then the holidays are upon us. My goodness, it's been a year. Man, this year's gone fast. As always, it always seems like that. So, but let's continue on because I was hoping to get through the rest of this today, but if not, that's fine too. Um, but if you guys, I think all of you guys were on last week. So we were talking about, just to refresh your memory, this we're talking a lot about pediatrics and kids, but really plugging in your story. And I got messages from many of you, actually, a few of you that were like, wow, like I can just see some of these things from maybe the time you were born, into like potentially leading into and contributing to some of the struggles we still have as adults, because that does happen. So we were talking about this perfect storm, kind of analogy. And we left off, I covered these two slides, but just kind of refresh your memory where we left off is, birth trauma is a big deal. It happens a lot. Birth trauma for mom, for baby, etc. But, as time has gone on, I think the main point here is, you know, delivery of a baby, of course, is just something that's natural, but of course there can be complications. But as time has gone on, in an attempt, again, I fully believe that medicine, modern medicine, there's so much good in it, and a lot of times things are done with nothing but good in mind. So interventions, that have saved, who knows, countless, moms, babies. So interventions like inductions, interventions like forceps, vacuums, C-sections, just all of those things. The missing gap. Okay, so there's no talking ill of those things. But the missing gap is like what's happened in these processes to mom, but also to baby. Really important. And what are we missing? What is it a contributing factor to some of these things that we're seeing with chronic illness and spectrum disorders and nervous system dysregulation, etc. So that's kind of where we left off. Um, and I just kind of talked about this term called dysautonomia, which is dysfunction of the autonomic nervous system. Okay, the autonomics, again, is your fight or flight and rest and digest. Those two things. Most of it is subconscious, it's not controllable by thought, right? These are automatic things that are happening in our body, right? Your stress response, a flight or uh, fight response, the vagus nerve, which is kind of your calming, controls your digestive system, has a lot to do with brain health, behavioral issues, etc. Social and emotional regulation is along with immune system function. So whenever anytime this stuff is dysregulated or disrupted, there can be issues that arise from that. Okay, so we talked about this. Remember the video, the moonwalking bear video I showed you last time? So the vagus nerve and some of this nervous system dysfunction can really be that moonwalking bear. Like a lot of times, most of the time, it's not something that's being evaluated and looked at. Okay, because it can be tricky. So someone might be sitting there thinking, okay, well, I had a baby and they evaluate the babies in the hospital, right? Or a pediatrician checkup, and they're looking at what's called the APGAR scores, right? So respiration rates, oxygenation. They're checking babies to make sure they're healthy before they release them from the hospital. So you might be like, well, what are you talking about? Like, how are they not catching this stuff? Because they're not looking for these specific things. Okay, so a baby can be functioning with the APGAR scores being high and still have issues going on. Okay, so we're going to kind of talk about that a little bit more. So the brain stem, okay, so the very, very, very top part of your neck and then into your skull is where your brain stem is at. Okay, so it's protected partly by the skull bone called the occipital bone, but then it does kind of descend a little bit. So the brain stem and that upper cervical spine are just really, really important. And so that is, to answer that question, the most common area of birth trauma on a baby is the cervical spine. Okay. So the skull and the spine are meant to house and protect the most important aspect of our health, the central and autonomic nervous system. So a lot of your autonomic nervous system control comes from your brain stem, okay, and your cerebellum and all the things clear up at the top of the neck there. Physical injury during birth can alter nervous system function from the first moments of life. Okay, how is this possible? Okay, so first and foremost, know what this region of the kind of upper cervical spine, what that part of your brainstem and nervous system control. Okay, so you can kind of read through this list, but it's critical to not have dysfunction in this area. Controlling nerves responsible for baby breastfeeding, latching, for digestion and immune function. How many of you guys know someone who has a baby, or maybe you had a baby, man, they did not want to latch. They had trouble breastfeeding. You're going to lactation consultants. And I mean, we hear this all the time. All the time, this is happening. Babies will feed on one side, but not the other. I will tell you right now, I never once in my office clinically saw a baby that would latch on one side, but not the other, that there was not something going on with the baby's neck. And that was one of the primary reasons. Okay. It could be a mechanical issue, like, man, it hurts for them to just kind of like turn to that side. So they don't want to eat on that side. Or some of this neurological stuff. Okay. How many babies right away have MSPI, whatever that is, milk soy protein intolerance, right? Or other allergy issues where they have to put them on formula right away. That's not quote unquote a normal thing, guys. Okay, so could some of it be tied to this stress response that's been going on, potentially even before they were born? I would say yes. Okay, the second one, control nerves and muscles responsible for draining fluid from the ears, the sinuses. So again, a baby might be very uncomfortable. If a baby's colicky, crying all the time, won't sleep, won't calm, they might be hurting. There might be fluid. There might be stuff going on. Okay. And then, of course, when we get into the toddler years, if this continues, why do you think so many kids have ear infections? Okay. Ear infections all over the place, all the time, tubes in the ears. Okay. There's a mechanical blockage somewhere. So, again, clinically speaking, back when I saw a ton of kids for this kind of stuff in my office, and we would do manual work to literally just open up the drainage pathways because your ears, the eustachian tubes drain. Okay, if they get clogged or if there's some sort of constriction, and that can come from the neck, it can come from tight muscles, nervous system dysregulation, all these things. Okay, the fluid can't drain, so it gets clogged, and that creates the ear infection. So all the time we'd be working on releasing this stuff in little kids, and the ear infections would go away. Okay, and again, I think I told you guys garlic mullein oil is what we always used. So we would work on our kids' necks when they were little, use garlic mullein oil, which is just an antibacterial, antimicrobial, natural. We put in our kids' ears. Never one ear infection. 3 kids, never one ear infection. I mean, it's kind of like unheard of, right? Control and regulate the immune system and inflammation, control and regulate sensory processing. So this is where you start getting into, the sensory processing disorders potentially, eye contact, eyes, auditory, smell, touch. I think back to my childhood, and I was like in my 30s when I finally figured it out after studying all this stuff for so long, that I have a form of a sensory processing issue. Because I can remember when I was 5 years old getting made fun of because I was always playing with my socks, always playing with my shirts, like the tags on my shirts, like they just bug me. Like I couldn't have a wrinkle in my sock. It drove me nuts. That's a form of a sensory processing issue. Okay. So it can be minor, mild things like that, all the way up the spectrum to autism. Okay. Sensory processing issues are all across the board. Okay. And it all stems from, I would, again, hypothesize, because there's no proof that you can say this, but you guys, I told you last week, like I was born in 9 minutes from the time the first contract, like it was so fast that, and I'm pretty sure I hit the table. There was no one even there to catch me. So it's like, what happened to my neck? Like, I probably started out life with whiplash. You know what I mean? Like, is that where this stuff started? Potentially. And I'm going to show you some research to kind of show some of that proof. Control and regulate motor development, the milestones, tone, balance, coordination. Okay, so milestones, developmental milestones. Just a couple of years ago, they changed the milestones. I don't know if you all caught that, but they started to move things back. What I mean by that is instead of a baby supposedly trying to walk or sorry, crawl at a certain month and then walk at a certain month, they started to push it back later. Okay. That's not because it should have changed. It's because we're seeing these delays more and more and more. So they made the normal further in the future. I don't know if anybody knew that. I'm not going to go into the detail today, but it's just kind of crazy. Like that's what happened in our governmental bodies that kind of set these regulations. Okay, because we're seeing more of these motor development and milestone delays in kids. Okay, the tone. What do I mean by tone? So if you've had a kid or you've been around babies, you'll know what I'm talking about. If you've ever had a colic is just like a baby that's fussy, right? It's just like they don't know what's going on. There's it's a diagnosis, kind of like irritable bowel syndrome. It's just like thrown at you, but they don't even know what's happening because they don't investigate it further. So a colicky baby is just an unhappy baby. Can't soothe. They cry all the time, maybe not sleeping well. And a lot of times what you'll see is they'll arch their backs. Okay, they arch their backs a lot. And if you actually feel their along their spine, the muscles of their back, they're just like they should be soft and supple. Like these babies, especially newborns, are supposed to be like puddles of mush, really, until they start, using and moving things. But so many babies are rigid. Their muscles are already tight. That is a fight or flight response. The muscles are controlled by the nervous system, the brain, uh, brainstem, this upper cervical spine, and they're already like crazy uptight, tight babies. Okay, that's not normal. That's not normal. Control and regulate all initial brain communication and coordination. So this is where social, emotional, behavioral kind of stuff comes in, mental health type stuff. So we get into like when a baby starts getting older, toddler, and then school age years, they're labeled and diagnosed with ADHD, and they can't pay attention in class, and the behavioral issues start happening, all this kind of stuff. Has anybody ever heard this, that specifically with little boys, it's better to delay them starting in school? Has anybody ever heard that compared to girls? So a lot of people will start kids in kindergarten at the age of 5, right? And that there's actually been some cool studies that have shown boys do better if they're 6 or 7 even, like starting later because their developmental stuff is happening a little bit more delayed compared to girls. So if you think about that, like how many, most, I'd say not all, but a lot of the little boys are the ones that are causing some issues and having these social emotional regulation control centers. And a lot of it has to do with the nervous system development and timing. So we can do a lot of good for our little boys by just holding them back, letting them just play. Like they don't need to be in a classroom yet, maybe sitting all day, expectations like that. So anyway, that's a whole nother topic. But in case you've never heard that, there is some cool stuff that they've shown with that. So, a quick kind of recap of the perfect storm sequence. So, genetic factors can always be attributed to some things, but epigenetics is kind of where it's at. If you're unfamiliar with that term, if you don't remember, epigenetics is lifestyle. Okay. So, basically, the lifestyle, the things we're exposed to, the things that happen to us, those three stressors: emotional stress, physical stress, chemical stress. Those three things, that's epigenetics. Number two is that stress during preconception and pregnancy. So we see it that if a mom, and then again, I don't let dads off the hook. Okay, so mom and dad are super stressed out before they even have a baby, and then during pregnancy, it really hardwires a baby to be kind of fight or flight. Number three is the birth interventions and traumas that we're going to do a little bit more deep dive on today. Number four, what this stuff leads to. So now we're getting into, okay, a baby's born. These are the symptoms and the things you're going to start seeing. Okay, they might not have all of these, but if they start checking some of the boxes. So difficulty nursing, we already talked about that. Colicky, fussy, doesn't sleep through the night, constipation. I already said sleeping struggles. Sometimes it's hard for me. With my family, but also friends. I was just actually with a group of buddies this weekend, sitting around a fire, chatting. We do that about once a month, and sometimes, as good of friends as they are, and they all know what I do. So sometimes they ask, but sometimes I just have to let them talk because a couple of them were just talking about how their 4 and 5 and 6 year olds like still wake up every single night, and they come in their bedroom and they wake them up, or they have nightmares, or they never get a full night's sleep. and kids that aren't sleeping through the night. And I just want to help them, right? Because that's not quote unquote normal. Again, people probably wouldn't believe me, but three kids, our kids were sleeping through the night. I mean, of course, when a newborn baby, they get up to feed 3 or 4 times a night, but it was very quickly within a few months that our kids were all sleeping through the night, and they always have. Never have had an issue. Okay, we're not special. We just knew what to look for and what to do about it. Okay, so if you guys know people that are struggling with this kind of stuff, um, the sleep, of course, you guys know is one of the most important things for our health. And so if a kid is not sleeping through the night, we need to figure out why, because that's a huge detriment to their health, their immune system, everything. All right, number 5 is the chronic ear infections, and then the gut challenges start, immune system challenges, the chronic sickness, chronic illness. A kid, a lot of kids, my kids get sick, but man, they kick it quick. We call it kick the sick. How quickly can a kid or an adult? So how long does it take you guys to kick an illness? Like if you get a cold, if you get a sinus, whatever, flu, doesn't matter, COVID, it doesn't matter what it is. How quickly does that get out of your system? Can you fight that like you're supposed to fight that? Or not? And can a kid do that? So if a kid gets something, I mean, my kids are rarely like asymptomatic for more than a day or two. I mean, and that's like really healthy. Like, yes, they've spiked high fevers. Yes, they've had coughs, terrible coughs. Yes, they've had all of this stuff. We treat it naturally. We've never had them on a medication, and we clear it out. That's what the body is supposed to do. There's this myth out there, okay? And I don't know, hopefully you guys have heard this, but okay, so again, time and place maybe for everything, but like fever reducers and cough medicines, like logic, let's think about this logically for a second. Why would you potentially not want to do those things? Anybody have an idea?
Well, so say the cough is actually getting the stuff out of their system.
Yes, we need the cough. Okay, now again, we're speaking general. You guys all know me. We're generally speaking today. If there's some sort of a stridor, wheezing, I mean, okay, if you feel better about it, take your kid into the pediatrician and be. It's better safe than sorry. But just be informed because our kids have had all that crap too, whooping, cough, all of it. Okay, we never had to have them do anything. Okay, now again, our kids are healthy; they're not immunocompromised. So again, there's a time and place for everything. What about fever reducers? So Denise, perfect on the cough. You need to cough. You need to express. You need to get crud out. That's your body's self-defense mechanism. What about a fever reducer?
And the fever is actually helping your body fight the infection or whatever virus
Absolutely.
or bacteria.
100%. Fevers are there for a reason. They're a defense against these things. They're trying to kill stuff. Okay. So again, I'm not going to go into like when a fever is too much because 104 is kind of the most known. Like, oh, when a kid gets a 104 temperature, that's like nearing emergency. And again, I would recommend you guys, to get that checked out because bad things can happen if fevers get too high. Okay, that is absolutely true. Some not good stuff. So better safe than sorry. But I can tell you, our kids have had over 104 temps, and we did not do anything besides get the fever down. Right, cool baths. I mean, just whatever, cool washcloths. We just decreased the fever on our own, and they fought it off. Okay, they need that fever, okay, to a certain extent. So just kind of a different way to think about these kind of things. Anyway, I'm going on tangents here, but 6 sensory spectrum behavioral challenges in your childhood: emotional, disorganized, focused, ADHD, those kind of things start happening. And then, of course, anxiety, depression, chronic fatigue, exhaustion when we get older, teenagers, young adults, and then us. All of us. We're not young adults anymore. I don't think any of us in here. So it's just age is just a number. You guys know me. That's my philosophy. Age is just a number. We're all young. We're all young here. So anyway, anybody have any questions with that? Okay. The next little kind of principle, somatic dysfunction, aka some people would say subluxation, dyskinesia. There's different terms for this, but basically, this somatic dysfunction or stress in newborns, how common is it? So what I'm talking about is I mentioned this a week or two ago. with like injuries, this birth trauma to the actual physical structures of a baby. So the spine, the nervous system, these physical structures. If you've seen a chiropractor, they might use the term subluxation, which means something different than a medical subluxation. FYI, medical subluxation means dislocation. So I dislocated a joint. Chiropractic subluxation means there's misalignment, there's fixation, there's lack of movement, there's stuckness, okay, which all impacts the nervous system as well. So in this study, I mentioned this before, but this is the actual study where they showed there was five independent, I think I remember this correctly. It's been a while since I've looked at it, but there was five independent physicians, DOs or MDs, I believe they were. So they weren't, I don't think they were chiropractors. They were medically trained, and they still found in 100 infants, newborn infants, within 6 to 72 hours of being born, 99 out of 100 of them had at least one pattern of this quote unquote subluxation. So that basically means they had at least one injury to the spine and or nervous system after being born. 99% of them. I don't know if that blows your mind, but it blew my mind. Okay, and if you, I know you guys probably can't read it, but in the results section here of this study, it was 99% of uh, most of those were the upper cervical spine or the cranial bones. Okay, so like misshapen cranial bones and pressures and all the stuff that can happen. But a lot of those were in the spine itself. A lot of them were in the lumbar spine, the sacrum. If you remember me talking about the sacrum, the pelvis, that's the other area of the parasympathetic nervous system activation. Okay, so again, the top and the bottom, think top and bottom. The craniosacral areas are the two areas of the spine that have the biggest nervous system input to the rest and digest and heal and grow part of our nervous system. So if there's injuries there at birth, is that going to cause that to be dysfunctional? And that is not a rhetorical question. The answer is yes. If you injure an area that has to do with something, it's going to affect that something, right? Just logically. Okay, so this is what this study evaluated. It was kind of crazy. Okay, so I warned you guys about this. If you have a weak stomach, I mean, it's not that bad of a video, but I mean, some people have trauma, around this kind of stuff. So I just want to give you a fair warning. There's going to be a video of a routine C-section. There's nothing special about this C-section. This is just how they're done. They make pretty small incisions, relatively speaking. It's not like they cut you, a woman from side to side. They make as small of incisions as possible. And then they have to get the baby out. So a lot of times, and I was one of the people who thought, man, that sounds less traumatic than a vaginal birth. But oh, was I wrong? Okay, and not only this video, but then if you just look at the numbers of babies that are born via C-section and kind of the chronic illness and chronic stuff that's going on, it's very correlative. Okay, so here's the video of a C-section.
Getting irritated.
So the first thing they're doing, you guys see that little device is a form of a vacuum. So they have the vacuum on the top of the baby's head. So that's providing a lot of suction upward. It's going to affect the cranial structures because the cranial bones, your skull bones are not fused together yet, obviously. So that can affect up there. And of course, it's providing what I'll call it axial traction. Okay, so basically, if I take my head or somebody takes my head and pulls me up, like decompression is something maybe a lot of you guys have done for your spine, but like this traction, this axial meaning upward force. Okay, think about this for a second. Even in an adult, our cervical vertebrae are pretty small and they're a lot less stable, thick, strong as like our low back, because obviously they only have to support the weight of our head. Right? So think about that in a baby. They got these little tiny vertebrae in their necks that are all cartilage at this point. They're not even bone. And you're having this force put upward. Now, that's only part of it. So the vacuum is enough axial compression or axial load. And now watch the rest. Watch what they do to get the baby out.
Come on, buddy.
Okay, heads out. So heads out. Okay, but now they have to get shoulders and the rest of the body out. So watch the and just watch. I think you guys are gonna get this.
I keep it for the camera. Oh, yes. It's going back. There you go.
Okay.
Getting irritated. I keep it for the camera. Oh, yes. It's going back.
Okay, right there. You see how much side, like how much lateral flow. So he's pulling up. They're pulling up while they're bending it forcefully to the side to get one shoulder out and then back the other way and then lifting. This is where a few weeks ago I gave the little silly story of like if you had a baby, a newborn baby in the hospital, and Uncle Joe walks in and picks your baby up by the head and just holds it there, like would you be okay with that? No, you would not be okay with that. You'd be like, put my baby down, boy. Like Uncle Joe. Like you can't do that. So this is a ton of axial traction or axial loading on that baby's neck. Okay. You guys understand the mechanism there? Like that's pretty intense because there's resistance too. It's not like they're just picking the baby up by the head. There's resistance because the shoulders are still trying to come out. Okay. So that's enough of that. I think you understand that. But this is another picture. This is a still frame shot of another method. So that doctor in the last video had kind of the hands on the side, but a lot of doctors will put, you see his right hand on the back of the baby's head. His fingers, this is not just, they're trained to do in the right way. So like the fingers on the back, you see how they're kind of hooked right underneath the skull bone. Okay, so they're literally hooking on the bottom of that skull bone called the occiput, which is right where your brain stem is, right where C1 vertebrae is. And then the other hand, his left hand is underneath the chin. Okay, you can see there's a little bit of rotation in the baby's head while they're pulling the baby out like that. So there's a ton of this, again, this upward traction on that little brain stem, on that little cervical spine. So no wonder there was 99 out of 100 of these little babies that they evaluated in this study that had cervical spine trauma. Undiagnosed, by the way. Like these are not things that they're looking for after a baby's born. They're not looking for it. I couldn't even tell you guys how many times I've seen families where a baby has a broken collarbone that was missed in the hospital, right? So like their little collarbones are snapped in half because of the way the shoulders and maybe they got stuck, whatever. And that's missed often too. It's very hard to diagnose that honestly in a newborn, but if they're colicky, if they're fussy, they're literally like they're in pain, right? So their fight or flight mechanism is just already boom off to the races. I talked about this last week, but then you can imagine like cord wraps, right? Think about a cord wrap around a neck of these little babies. So that's another reason that you can have a cervical spine trauma. So the cesarean rates, again, when I said some of this stuff is life-saving, these are life-saving procedures. Here's the thing that I personally have somewhat of an issue with. And again, I'm not judging anybody because a lot of times people do things and we're not informed. We are not informed. So the cesarean rates have skyrocketed. Now, how many of these cesarean rates are necessary? That's the question. Most cesareans are elective these days. Okay. Convenience? Question mark. The doctors will recommend it because, why don't we just do a cesarean? Easier. A lot of times the females will be told, the moms and dads will be told it's easier on the moms. Maybe moms have been conditioned to think like, oh, that's going to be easier than doing a natural birth. Again, there's always a time and place. There's some people that need to have a C-section. My sister was one of those. Because it was going to be something where if she tried to give birth naturally, it was going to be all sorts of complications and potentially devastating life or not to baby and her. So again, I'm not anti-cesarean, but why is this rate gone up so high and is it always necessary? And then even if you elect to do this voluntarily, the gap is that we're not evaluating and looking at these things, okay? And what could be affecting the babes. Okay, so that makes sense. Any questions with that? Okay, so go back to this. So with all of that said, the quote by Dr. Bruce Lipton, who's a PhD, a researcher in cell biology and epigenetic research, he says you cannot be in growth and protection at the same time. So if a baby is born into this protective fight or flight mode, they cannot be in growth at the same time. So you remember this diagram, right? On the left, the green, when the parasympathetics are active and working, we have growth, we have rest, relaxation, proper digestion, proper immune system function is happening, right? Milestones, brain development, nervous system development, so crucial in the first 3 years of life. Okay. So if a baby is in the red, if they're in this fight or flight because of all this stress starting out with potentially birth trauma, their gas pedal's already on. Okay. They cannot be in growth and protection at the same time. Okay. So correlate that to your story, correlate it to your kids' story, correlate it to friends, whoever you guys know. It just starts to make so much sense because again, you can see all of again, this is just the short list, but on the bottom of that poster, that page there, these are the things that are linked to this issue, this dysautonomia, right? Anything from asthma to chronic ear infections to behavior issues to later in life heart disease, high blood pressure, acid reflux, Crohn's, allergies, all of it. Okay. Few more minutes here. So the vagus nerve, we've talked about it, right? So it controls the entire gastrointestinal tract. It has partly to do with the brain and developmental centers for behavior and social regulation, etc. So, but this poster here, I'm going to blow this up in a second because we're going to take a look at the very top, kind of that maroon kind of box, and then the very bottom, kind of the orangish and the blue one here. So that's oh, I was going to make this point too. So let's just say hypothetically you have someone who's like, well, my baby it was an easy pregnancy, it was an easy delivery, but then they started having issues later, like they started to not sleep, they started to get colicky. So think about this, putting a kid too early into like a bumbo or a jumper or trying to get them weight bearing too soon, that is another problem that we see often. Okay. Also, even naturally, this is where like being proactive with a little baby is really good, is like when a kid's trying to learn to walk, how often do they fall? A lot. They fall a lot. And sometimes they fall forward on their hands and knees, but a lot of times, which way do they go? They fall and they land on their rear end. Okay. So if that's happening, is there potential that that is causing an issue? They're landing on their tailbone constantly. That sacral plexus, okay, is what we call it. Okay. The sacrum. And that's a high innervation area for this parasympathetic rest and digest part of your nervous system. Okay. So again, just things to think about that I see all the time in clinic. So again, that's going to be something that usually starts. And sorry if this is blurry, starting at like 2 to 3 years old. If you start noticing more issues at 2 to 3 years old, we trace it back to birth. Of course, it still can be kind of a delayed onset, but then you start talking about this kind of other stuff. Okay, if that's too blurry for you, basically what this is this is showing the nervous system from C1 to C3, which are your upper three cervical vertebrae. So right underneath your skull, down just a couple inches, are your first three vertebrae. Okay, on the left side where it says cause, okay, you're going to see things like, okay, this is where the nervous system for a lot of the autonomic nervous system, the vagus nerve, the brain stem, okay, you'll see ENT system, so the ear, nose, throat. A lot of the nerves that control the ear, nose, and throat come from this C1 to C3 area. A lot of the immune system, digestive system via the vagus nerve, etc. You guys kind of get the point. So there's a lot going on up here. Okay, and then on the right side, the effect. What that means is if there's dysfunction in this area, if there's dysfunction, if there was an injury in C1 to C3, then these are the possible things that could happen. And it's not an exhaustive list. Colic, excessive crying, torticollis and plagiocephaly. Basically, that means like if there's a misshapen head. Ear and sinus infections, allergies and congestion, immune deficiency, headaches and migraines, vertigo and dizziness, vision and hearing issues, TMJ and jaw pain, low energy and fatigue, difficulty sleeping. So how many of you guys deal with some of this? This is not just kids we're talking about, okay? Now, more severe stuff, epilepsy and seizures, sensory and spectrum disorders, ADD, ADHD, focus and memory issues, anxiety and stress, balance and coordination, speech challenges, high blood pressure, reflux, GERD, depression, and the list could go on. These are all things that are correlated to dysfunction in this area because of the nervous system, the neurology of what's going on. Okay, so now let's go to the bottom. So the T8 to T12 is going to be, you guys kind of see the picture here. On the very bottom on the left, that's your tailbone, okay? And then the blue ones are your lumbar spine, so your lower back, kind of where the curve is. And then the T8 to 12 are going to be those ones that are in orange. That's called the thoracolumbar junction. Okay, so I highlight that area because I find anytime, okay, so think about posture. Think about sitting all day. If you're sitting there right now, slouch over a little bit. Okay, you obviously round your shoulders, your head goes forward, but a lot of pressure is put on this area right here where that orange or those orange vertebrae are, right where your thoracic spine meets your lumbar spine. Now, what the heck does that neurology do? Okay, anybody ever heard about the adrenal glands? Okay, I'm just going to stop right there because again, gut and digestion, but the adrenal glands, huge area for adrenal gland dysfunction, kidney dysfunction. Okay, so that area of the spine, if it's messed up, if there's been injuries, if there's interference, if there's dysfunction, that can actually contribute to some of these things like excess cortisol, chronic fatigue, those kind of things. In kids, bedwetting, okay, constipation, things like that, all the time. Saw it all the time. And then you go into the blue area, so that lumbar spine into the sacrum where that parasympathetic plexus is. This is obviously going to have a ton to do with the gastrointestinal system. So constipation, diarrhea, and other kind of immune dysregulation, all the things that you see on the right over there. Okay, of course, then you got the musculoskeletal stuff like the sciatic pain, lumbopelvic SI pain, disc issues, all those kind of things are involved in that area too. Okay. That's a lot. Anybody have any questions on that specifically?
So with some of the stuff, would you just recommend like adjustments and then x-rays of the spine
Yeah, all of
as
that's
we
valid for
age?
sure. I mean, imaging of the spine is always good. X-rays can be good. But X-rays don't show everything, of course. MRIs don't show everything. But yeah, a good chiropractor, a good physical therapist, a good, people like that is part of your team. I think everybody should have. And that's not bias from me because I used to do all that stuff, still do, but used to do a lot more. But I mean, it's just kind of logical. It's like, but I always tell people was always my philosophy in practice is, you can come see me 3 times a week and I can adjust you, but it's like I want you to take a proactive role. So then you go to what I sent all of you guys a while back, that upper cross syndrome kind of postural rehab stuff. I plan on getting you guys a lower body one too. It's actually called lower cross syndrome. I'll probably do a presentation on that and then I'll send that all to you guys. So it's that, right? You need to be proactive, right? Like with finding the areas of your body that are weak, the areas of your body that are inflexible, that are immobile. And that goes a long way to keep your spine healthy. So then hopefully you don't have to depend on getting adjusted every single week, right? But that is very powerful. Any kind of body work like that it can be powerful for people for sure. That answer your question?
It did, yes. Thank
Yeah.
you.
And then of course with everything you guys are doing in functional medicine, it all ties together. The reason I'm
Mhm.
presenting all of this with the musculoskeletal system, of course, is the spine, right? All the muscles. But then you dive deeper into, the neurology, of course, and then you dive even deeper into how are these organs and things functioning with some of the lab work we've done. And all of it is relevant and all of it plays. It's like this vicious cycle, like kind of like the chicken and the egg. Which one was first, which one's, like there's so many different puzzle pieces. So that's why I encourage you guys all to at least assess and kind of work on all of these areas if you can. So I try to get you guys as much information as you can and give you all those resources. And then, of course, we talk about toxins. That's the next huge subject that's going to affect the nervous system development, and especially in a baby. So you're talking about environmental toxins, food, water, formulas. I'm sure you guys have all heard, oh my gosh, like you got to be careful with formula. There's just some nasty stuff in a lot of these formulas, just like everything. So you got to be very careful, and it's worth the money to buy good ones. Okay. Medications and antibiotics are starting to be introduced, in babies and toddlers for sure, with ear infections and all the things going on. And then of course you gotta at least throw in there the vaccinations and all the questions. Let's just keep it at that. Like the questions of how many our kids are getting these days. Is that good? Is that bad? Have they actually studied the effects? I think you guys would know where I'd lean on that one, but I won't go into that today because I know the answer. There's a reason. Okay, I said I'm not going to go into it, but there is a reason that nobody can provide the actual studies that show they have studied the interactions of all of these vaccines together. Multiple doses on one visit. Like, it's never been done. Okay. So you can study, and I would even argue that they haven't done long-term enough studies on individual vaccines. Okay. Because that's the other problem is some of these studies that the people will always cite saying, oh, we have studied this. Okay. Here's the problem with a lot of the studies. If you actually look at them, they're very short term. They'll only follow a kid for like 2 weeks. They're not long term. Like, how is this affecting the immune system? The immune system might not like have any sort of symptom or issue until years later potentially. So again, I digress, but it's something that I think needs to be looked at very, very heavily, which I think is actually getting done as we speak. So that's promising because again, I'm not anti, but I'm pro knowledge and actual good science. Last thing we'll do is this study, I think it was done in 2022, was looking at toxins, and specifically, I talked about this a number of weeks ago when it was kind of hot and heavy in the media, but it was looking at paracetamol, so acetaminophen, Tylenol use in pregnancy. So again, this was one of the studies that was done, a few years back. That just shows it's not as safe as maybe once they once thought. You guys all understand that like research is very difficult. Research not only costs a ton of money, it takes a ton of time, years for things. And then there's also the ethical thing of, well, we can't just give every pregnant woman high doses of, Tylenol because if there's a risk factor for the baby or the mom, it's not ethical. They can't. So it's really challenging to actually study the effects of this stuff. So you gotta kind of know the science of what does Tylenol do. And again, if you didn't hear that talk, I would encourage you to go into your education library and watch the talks I did on acetaminophen. Because and again, I'm going to keep it really easy here. Most of you guys have at least heard me say the word glutathione, right? Glutathione is your body's most powerful antioxidant. It's made by your liver. It's absolutely critical, okay, for fighting inflammation and cellular stress and cellular damage. Okay, Tylenol reduces glutathione tremendously in the body. Every dose you take will decrease glutathione more and more and more. So even if you just keep it as simple as that, that's not real great for anybody, especially long-term use. Okay, if you take Tylenol once, is it going to kill you? No. But if you take it, if you're dependent on it, which so many people are, and pregnant women have been told it's safe to take at will, basically, during pregnancy, I think is unfortunate thing. You know what I want to do here, because I know I'm over time. I'm going to finish this. I'll do this again, but I wanted to show you guys this slide because I know I've talked about it before, and I know a couple of you guys have asked me about it, so I didn't want to delay this anymore. So last slide here. This has to do, and I think Diane, you were one of the ones that asked me about this, but talking about neuroplasticity. So, okay, we have all these like injuries and insults to our nervous system. All of us do every single day. Is it possible for me to change? So this was the study done by the Center on the Developing Child at Harvard. Okay, so this chart here is what I wanted to show you. So the bluish kind of line is the brain's ability to change in response to experiences. So basically, when you're on the bottom, you see the numbers, that's the age. Okay, when you're between the ages of 2 and 4, you see how high that is? It's almost like 100% ability to change the nervous system. And then it starts to steadily decline. By the age of 10, it's like 50% already. And then, of course, it just keeps declining all the way. At the end, they went to 70. Okay, but it still would be there. So there's still an ability to change the nervous system and what's going on for sure till the day we meet our Lord and Savior. Okay, till the day you die. There's possibility to change. The orange line is then the amount of effort such change requires. So again, look at the beginning of the graph. You have high capability of change, blue line, and it doesn't necessarily take a lot of effort or time, orange line, when you are young, a baby, a toddler, a young child. It's kind of logical, right? It's going to take more effort and more time, more patience the older we get because things are more hardwired into us. Things are more damaged. Does that make sense to you guys? So I think it's cool because there's always possibility. There's always hope. There's always the ability for us to change. But my plea to you guys today would be this, that you guys are all here. You're all doing the work, but we all know people. And if you know people that have kids that are already struggling, get them somewhere. Give them this talk. Tell them to call me. I don't care if they work with me or not. I'll find somebody in their area, whatever it takes. Because I have a passion, and I'm sure all you guys do, for kids. I mean, in our generations, they're in trouble. They're in trouble. Okay. In 10, 20 years, I don't even want to know what it's going to be like, unless a lot of changes that are happening now continue to happen. But if they're struggling, if they have babies, if they have toddlers that are dealing with all the stuff we've already talked about, just get them some info. Okay, you can give them my number, you can give them whatever. But there's definitely things they need to be doing now because again, you guys remember last week when I said the notorious line that drives me more crazy than any line I've ever heard is they'll grow out of it. They'll grow out of it is used, and it's usually used because they don't know what else to do. But there is so much that can be done for these little ones. Um, and the proof is out there. I mean, this isn't just me talking. This isn't just my clinical experience. This is evidenced. Okay, there's research upon research upon research. It's just not mainstream. So unfortunately, so that's my plea to you guys over the holidays. Be grateful and be thankful for everything we have. We all, life is short. We never know what's going to happen tomorrow. So hug everybody you love. Hopefully you guys get to spend time with the people you love. And then also think about the people you love. Okay. Neighbors, coworkers, family that are struggling. And if there's something that you could say or do or whatever, give them my info or somebody else's, then that would be amazing. So, okay. All right, y'all. If you have questions, I'll hang out for a minute or two. If you do, I'm happy to stay. I have a few minutes here. If not, happy Thanksgiving to everybody. Be safe traveling if you are, and hunker down in Wisconsin.
Thanks.
Happy Thanksgiving.
Happy Thanksgiving.
One thing that